So thank you very much for Jenna Ryan and Dr. Carrie Azen joining us today on our Genève weekly wellness webinar and they're both from Uqora. So we are going to hear more about this company and what they do. I am Stacy Kazanchuk. I'm a registered dietitian nutritionist here for Genève and Genève's director of health coaching. I'm also an exercise physiologist and work with our clients in terms of implementing lifestyle changes to help them manage their menopause symptoms. So from here, I'd like Dr. Dunsmore-Sue, also one of our Genève telemedicine providers, to introduce herself to give us a little bit background of your role here.
Hi everyone, this is Rebecca Dunsmore-Sue. I'm Chief Medical Officer at Genève, and so I oversee our telemedicine program as well as sort of the medical content that we put online. I also am a telemedicine provider, as Stacy said, so I see patients in several states where I'm licensed.
Thank you. And Jenna, can you introduce yourself to everyone here so they know your role with Uqora?
Yeah, absolutely. I am co-founder and CEO at Uqora. We make products for urinary tract health, and I think we'll get more into that, so I'll just leave it as CEO, founder of Uqora.
Excellent. And Dr. Azen, go ahead and introduce yourself to everyone.
Hi, I'm Carrie Azen. I'm a urologist practicing in San Diego. I did my medical school and urology training at Columbia University in New York, and now take care of patients with a wide range of urologic issues. One of the areas that my past research and my current practice focuses on is patients with urinary symptoms and recurrent urinary tract infections, and I'm a medical advisor for Uqora.
Excellent. Thank you very much. Well, certainly menopause does bring out some changes when it comes to urinary tract health, and we're going to talk about that in a little bit. But I'd love, Jenna, if you could just give a little bit of background on Uqora, especially for any of our participants or listeners that may not have heard of Uqora, and really your brand and story of development.
Yeah, I would love to. So we got started at Uqora a little over 3 years ago now. And got started because it's something that I have always struggled with myself, UTIs. I've always been prone, but it really came to a head one year. I had 8 UTIs in 1 year. And I loved my physician care. I felt really well taken care of, but I just felt like I was running into the same recommendations for preventative care. And I wanted to figure out what I could do to be proactive. And this experience inspired me to start Uqora. So we make proactive urinary tract health products. We have 3 different products that all come at urinary health from different angles, and we've been able to help over 75,000 women stay proactive at this point. We're also a few weeks away from launching a few more products that are for UTIs specifically, an infection control product, a symptom management product, and an at-home diagnostic test strip. So we're excited to be able to expand our line to people who are actively struggling with UTIs. And just generally, I love being able to tackle UTIs because it's a major problem. It's the 2nd most common infection in the US, second only to the common cold, and half of all women will experience a UTI at some point in her life. And when we were starting out, I knew how UTIs were affecting my own life, but I didn't realize how widespread they were and how ubiquitous they are across so many age groups. So a lot of people start getting UTIs when they become sexually active, but there's a few stages of life that increase our susceptibility to UTIs, and menopause is actually a big one for a lot of people. So, you know, some people may have UTIs flare back up or get them for the first time in menopause, which I know we'll talk more about, but it's just all that to say it's really great to work on something that I've dealt with personally and that touches millions of women across the globe.
Excellent. Thank you for that introduction and background. And Dr. Dunsmore-Sue, can you give some background just in terms of Genève and our overview and story, especially since you've been a part of the company longer than I have?
Sure, I'm happy to, Stacy. And many of our attendees will know Genève, so I'm going to be somewhat brief about it. We are a company, basically sort of your online resource or clinic for women in midlife and menopause. And so Genève does a whole host of things, and we sort of approach menopause as a holistic package thing. So we have tons of free education, such as these webinars, podcasts, blog pieces for women to search on and learn a bit for themselves. We have telemedicine services, so menopause practitioners in 49 states at this point. And then we have products such as lubricants and intimate moisture products, as well as supplements and herbals. And so, and then last but not least, what Stacy does, which is our health coaching service, which is a subscription service where we help women sort of make a holistic change to their lifestyle in order to better manage their symptoms, but also their long-term health in menopause.
Excellent. Well, both, we've alluded a lot to changes in menopause and connection to urinary tract health. So I'd like to direct the next part to talking with Dr. Dunsmore-Sue and Dr. Azen, a discussion just on what is actually happening. I'm sure many of our listeners are experiencing this, but what I find in talking with women in menopause is that there often is some gaps in their knowledge about what's happening with their own body. So I think we can serve to help them with that today. So when it comes to urinary tract changes during menopause, Dr. Dunsmore-Sue, can you just give us an overview of what is happening in the body with urinary health during this time of life?
Well, actually, I'm happy to speak to the changes of menopause, but I tend to approach it from a vaginal health perspective, which impacts urinary health. And I'm going to leave to Dr. Azen to talk about the actual urinary structures, because that's her expertise. So in menopause, as women know, our estrogen levels decrease. This is a natural, normal change in the body. And along with that, we tend to see changes in the vaginal mucosa and the structure of the vagina. This can happen over the first couple of years in menopause. It's usually not a right away thing. It sort of happens gradually over time. And when those changes in the vaginal mucosa happen, what also changes is the pH of the vagina, as well as the bacteria that like to live there. So in a woman with premenopausal levels of estrogen, we tend to see a lower or more acidic pH of the vagina, as well as bacteria that are more specific to the vagina. So Lactobacillus crispidus, Lactobacillus gensii. And there are different patterns of bacteria that we see in different women, but in general, those are the bacteria we see. And then as we get into menopause, the pH actually goes up, which I think surprises some women to find out. And we tend to see flora that more closely resemble the bowel flora tend to take up residence. And you can get sort of a more polymicrobial situation there. And that can impact urinary tract health or frequent UTIs, because suddenly you've got bacteria a lot closer to your urethra, which aren't necessarily supposed to be there. And then I'm going to pass it on to Dr. Azen to talk about exactly how estrogen affects the urinary structures.
So estrogen has a big impact on sort of the whole area and everything you were saying for the vagina and the labia, the urethra and the bladder. So some of the things that you can see is an increase in urinary incontinence, urethral prolapse or urethral stenosis. I'll see patients that have a harder time emptying their bladder, in addition to the patients that have an increase in incontinence. Just like Dr. Dunsmore-Sue had said, the change in the bacteria of the vagina can cause a big increased risk in increasing a risk of urinary tract infections as well. Other things with an increased risk of pelvic organ prolapse, having less support in the area, that can make it harder to empty well, or increased risk of urinary incontinence. I see patients with a wide range of urinary complaints. Sometimes it's an acute urinary tract infection. It's symptoms that very clearly have a diagnosis of urethral stenosis. They can't empty, things like that. And other times the symptoms will be more vague and more gradual, just noticed over time, more frequency, more urgency, more leakage, sometimes pelvic pain, pelvic pressure. And that's a big part of sort of teasing out exactly what the cause of it is. And a lot of times the treatments for what we call this whole syndrome of gendo-urinary syndrome of menopause can really help resolve all of these symptoms. And it can have just a huge impact on their life, whether it's something that's an acute urinary tract infection, all of a sudden worsening urinary incontinence, difficulty emptying, or these vague symptoms that may come and go but really impact quality of life.
Yeah, that sounds, again, going back to estrogen is so important, and we learn how it's important when it starts to go down. um, Dr. Azen, would you mind, you use some terms, and I don't know if I'm going to even get them correctly, but urethral stenosis, I think, was one of them, and there were some other ones in there. Can you maybe define some of those for our audience that may not be as familiar with those?
Sure. So some of the specific changes that can happen to the urethra. So I was saying when you have the estrogen, how important it is that keeps the urethral in someone younger, kind of healthy and plump. And that's part of our continence mechanism is the urethra staying closed. If it atrophies and you kind of have it a little more open, there's other continence mechanisms, but by removing that one, you have that sort of it's more lax, more open, and that can be one of the things that increases the risk of stress urinary incontinence. You can also have urethral stenosis just with the same issues with the tissue, but if it scars down a bit, then it's more of a narrowing and it can be harder to empty the bladder well. Then other things like urethral prolapse is seen sort of in different stages of life, but particularly it's seen in postmenopausal women. And that's where the urethra can actually come out. And that can cause pain, it can cause bleeding, and most people can also be managed conservatively based on how much it bothers them, but in some people it causes a lot of pain and a lot of bleeding and is very problematic. There's sort of other variations of that prolapse if only part of it is falling out or if it's sort of the whole urethra coming down. And then pelvic organ prolapse is kind of what it sounds like, where you have various, it could be the bladder falling down, it could be the rectum or intestines coming down, often it's the uterus or the cervix coming down, and that can also, if you think about everything kind of in that pelvic space, moving around is going to have big impacts on everything else that's there, and so that can really impact the ability to empty or the ability to have urinary control.
Okay, thank you. Yeah, that helps to give it more insight to, and so many things that can happen in a small area, but obviously one thing can easily affect another. Well, with these things that could potentially happen, especially during menopause, I imagine I get a lot of questions from women too that I'm working with of what can I do now to prevent things? How can I prevent this from happening to me? And while we might not be able to guarantee 100%, or in fact, we can't guarantee that it won't happen to them, what are some strategies, Dr. Azen, that you recommend when it comes to prevention?
So, like I said, a big portion of, or a large portion of the patients I see is for recurrent urinary tract infections. And so I really like approaching this with sort of a set conversation, and then the patient fills in their goals and their priorities, and we formulate a plan together. But the first thing that I like to talk about is the fact that some people are just more susceptible to urinary tract infections. And in those people, the chance of getting you to 0 UTIs ever is low. So I don't want them to feel like ever having another UTI means we've failed or they failed and they have to start over. Our goals are, number one, we want to try and decrease the number of urinary tract infections they're getting and lengthen the time between urinary tract infections, which is actually what a lot of the studies look at, specifically letting us know 0 isn't necessarily the goal, but we're trying to improve things as much as possible. And then a second thing that I'll talk about is that our goal is to control the symptoms as much as possible. Some people will have horrible, and most people have horrible symptoms with those acute urinary tract infections, and that's kind of the definition of an actual urinary tract infection. But in between, they may have flare-ups with vague symptoms, and I want to keep those under control too, to really help tease out when exactly you're having UTI and when is it something else that's going on, which we see a lot in that peri-postmenopausal patient group. And then the third thing is that my goal is to reduce the number of courses of antibiotics that the patient needs. And again, we may not be able to get that to 0. We may, but the goal is to reduce it as much as possible. And so I talk about a lot of different options, and there'll be a lot of information. And every time I see them, we'll kind of go over it just because it's a lot. I'm careful to explain to patients that there's variable data. So there's not a ton of great research in this space, and that's part of why I'm so excited to be working with Uqora. Is I want more research, I want more to present to my patients, and I'm excited that that's coming. But I'll go through each one. So first, I always talk about increasing water. There's some pretty good data out there saying if you increase your water intake, specifically in patients that have recurrent UTIs, there was a study that showed they decreased the number of urinary tract infections in that group by half. So just something that basically has no risk of water, to be able to drop that number in half is a pretty good place to start. And then in that peri and postmenopausal group, I will always talk about vaginal estrogen. It's not always the right thing for everyone. Some patients are nervous about it or have a reason that they can't take it, but for the most part, that is something that I'll recommend for all of my peri or postmenopausal patients, because there's some pretty good data out there as well suggesting that that's a good way to reduce the risk of recurrent urinary tract infections as well. And then where I go from there, I explain, tends to have less robust data, and it's more just what people do, and most of the things that's written on it, the idea is it's very has very low side effects, so there's very low risk for it. So if we can find something that works for you that's not an antibiotic, fantastic. And I'll talk about things like probiotics, especially for patients who have been on a lot of antibiotics, and fitting into that world, constipation control, which again seems like it's out of the world of urinary health, but you're thinking about, you've only got so much room in that pelvis, the rectum's pretty close to the urethra. My goal is to help my patients, or encourage them to talk to their primary doctor, to get them to the point where they're having a soft bowel movement without straining every day, because the more we can sort of reduce symptoms to the whole area and general health to the whole area, the better patients tend to do. I'll talk about good emptying techniques, trying to make sure they empty their bladder all the way, making sure they're not holding their urine for long periods of time. If they have incontinence, we try and get that under control, because if they're sitting in wet liners all day, that's also going to make it harder to control those urinary tract infections. And then there's a variety of other things. I'll talk about methenamine, D-mannose, cranberry. If a patient is a dysfunctional voider, so maybe they don't empty well, maybe their pelvic floor has problems, I'll talk about pelvic floor physical therapy. And then in the world of controlling their symptoms, I'll talk about symptomatic control when they have symptom flare-ups or urinary tract infection flare-ups, with the role of things other than antibiotics like phenazopyridine or ibuprofen, increasing water intake again. And then ultimately, some patients do end up on prophylactic antibiotics. I try and minimize that as much as possible, but in some patients, especially in older patients, if they're ending up in the hospital a lot, we talk about the risks, we talk about the benefits. If they have family members helping make those decisions, I try and include everyone in that, just because you don't want to take adding medications lightly, but there are some patients that's ultimately where we end up.
A lot to consider, it sounds like, in this area of health for women, especially during the later in life, whether it be menopause or even postmenopausal. Dr. Dunsmore-Sue, anything that you do in addition to what Dr. Azen has mentioned in terms of working with your clients on prevention strategies or recommendations there?
No, and I think we have a fairly similar approach to this. Obviously, being a gynecologist, I tend to start on the vaginal estrogen because it's what I know and it's what I do. And, you know, I spend a lot of time reassuring women that vaginal estrogen is safe for almost all women. It does not come with an increased risk of cancer or heart disease. Those studies have all been done in systemic estrogen, which is not the same thing. The vaginal dosing is very, very low and does not absorb into your systemic circulation. I also reassure patients that even patients with hormone-sensitive cancers, such as a breast cancer, our national organization has said that it's safe for them to use a vaginal estrogen because it's considered so ultra-low dose. And then, you know, in some patients, I'll sometimes add something, again, talking about the things with less good data. You know, the vaginal estrogen has very good data, increasing water, anti-constipation, I highly agree, both because there's just so much room in the pelvic bowl, but also because constipation really does a number on the pelvic floor. And so just regaining that muscle control once you're having soft daily bowel movements is key. And then we'll sometimes talk about laser treatment with Monalisa laser. Again, less good data. There's a little bit for urinary issues, but really not a whole lot. I don't personally tend to recommend probiotics except for gut issues, because most of our probiotics are oral and they treat the gut very well, but studies have shown they don't really treat the vagina very well. And we're still learning about the vaginal biome for the most part. I think there's some great studies being done at Massachusetts General Hospital and with different research groups right now, but I think there's more to be done in that arena. But that's my basic approach. And then when I'm unsuccessful, I send them to people like Dr. Azen.
Thank you.
Excellent. Well, Dr. Azen, one thing you mentioned, you talked about this idea of really trying to limit medications as a last resort, and you specifically mentioned antibiotics. Can you speak to what are some of these risks of overusing antibiotics, and how do you think responsible prescription looks like for UTIs more specifically?
Sure. So antibiotics have many risks associated with them, and I think there's more and more being published all the time. There's a risk of adverse reactions, which can include allergies, organ toxicities. I think something that's getting increasing attention now, at least in the medical world, but perhaps for others, is something called C-Diff, which can be ranging from diarrhea to, it's a bacteria that can take over the colon basically, and it can range, the symptoms can range from diarrhea, or it can cause something so severe where the colon basically stops working and the only treatment is surgical. So it's not something that is taken lightly. So then another risk is an increase in resistance. So I'll see patients, oftentimes by the time patients get to me for urinary tract infections, it's not because they had one, it's not because they had two, it's because, like Jenna was saying, they have their 8 in 1 year, and now they come to see me after being on so many antibiotics, and I take a look at their urine culture, and it's just running down the list, resistant, resistant, resistant. I did my residency at Columbia, a big medical center, and there were times where we'd be urgently admitting patients to put them in IV antibiotics, not because they needed IV antibiotics, but because we had no other options. There were no oral that they were sensitive to that could treat their infection. And then something else that's interesting, that's maybe a little bit different than when you're thinking about urinary tract infections, but there's the idea that, and you were just talking about the vaginal microbiome, but there's the idea of the bladder microbiome. So historically, everyone had this idea that urine was sterile, bladder shouldn't have any bacteria in it. You have bacteria, that's a problem, we have to treat it. And more research is suggesting actually no. And the opposite, having bacteria, good bacteria, the normal bacteria in the bladder can be protective against urinary tract infections. And so if you just have bacteria in the bladder, but you don't have an acute onset of symptoms, we call that asymptomatic bacteriuria. And there's research studies showing that if you treat that asymptomatic bacteria and get rid of it with the antibiotics, you increase the risk of recurrent of actually getting symptomatic urinary tract infections. So just taking antibiotics in general is not something that we want to be taken lightly. Again, sometimes you do need antibiotics, and in that case, it's really important to choose an appropriate antibiotic and an appropriate course. And the Infectious Disease Society of America actually has put out guidelines specifically saying first-line antibiotic choice, second-line antibiotic choice. These are the durations. If these aren't an option, look into these others, and this is how long it should be. And it can be tough because if you're not someone who really treats urinary tract infections all the time, and you're just going to sort of, the antibiotics that are usually prescribed, I do see a lot of patients that come in with several week courses of antibiotics for a uncomplicated infection, and the recommendations are for the first lines are actually they're 3 or 5 days depending on which one you choose. So these poor patients will come in, sometimes by then they have side effects from them, and it's important to know exactly which medication you're going to prescribe and how long if you're going to go ahead and do that.
Wow, a lot to consider there. Dr. Dunsworth, how about in terms of your patients that you've seen and what approach you use?
In terms of how to treat UTIs, or?
From the treatment standpoint, and then also incorporating antibiotics if you need to, and how you go about weighing that decision.
Well, it's interesting, and I don't know the state of the research on the bladder microbiome nearly like I do that of the vagina, but, any antibiotics we use disrupt the flora of the whole body. So, we have to take not lightly the giving of antibiotics. If it can impact the gut flora, it can impact the vaginal flora and all those things. And certainly from a gynecologic perspective, I'm always worrying, okay, so we take this antibiotic and then we've upset the vaginal flora, and do we end up in a yeast infection or a bacterial vaginosis and all these other things that we then end up having to manage. And so at least when I'm treating someone with an uncomplicated UTI, because that's the type I tend to treat. I don't treat people who have lots of frequent UTIs. They're with Dr. Azen. I tend to stick to things that are lower impact on the rest of the body. So antibiotics that say concentrate in the urine or things like that, or try to get as narrow a bandwidth of antibiotic as I can find. So usually, you know, I very rarely treat a UTI without knowing what I'm treating. I tend to send for culture so I can pick the antibiotic that'll treat it, that treats the fewest other things as well.
Excellent. Well, thank you both for sharing your approaches on that. Something that we've also heard from both of you is that while there is research in some areas, there are some gaps that need to be filled in a lot of areas, and certainly that's a common theme in menopause in general. But I'd love to transition over to talking to Jenna and Dr. Azen as well as the topic comes up in terms of what Uqora is doing around research. I saw on your website that there are some research that's being conducted, and wondered if you could share a little bit more about that and maybe how you're collaborating on those upcoming projects.
Yeah, so we have a handful of studies in the work. I should mention that all of the products are based on the best research available. And it's third-party research. And to Dr. Azen and Dr. Dunsmore Sue's point, we need more. True of most all women's health topics. Mm-hmm. And so, you know, we're really excited to be working on that in particular. So we are running a clinical trial now. It is a over 300 subject, double-blind, placebo-control study measuring the recurrence of UTIs in a 6-month period. And that's looking specifically at Uqora's products used together. So it'll be first party, and we're aiming to wrap up the trial later this year and publish the results. And we have 2 more studies looking at similar outcomes. And those are in the more beginning stages, but you know, our goal is to have 3 really solid trials to start, specific on proactive care. And we're really, really motivated on looking beyond that too. We're in the really early stages of a drug program for a non-antibiotic treatment, which really just gets to that same sort of outcome of raising the bar, raising the volume of research available for this huge, huge public health issue.
Well, thank you for doing that and pushing that piece of it to get more research done in this area to certainly help inform what's preventative treatment or treatment options are available to women. Out of curiosity, in terms of the research that you're doing, and again, whatever you're able to share, the population, do you know, are they, in terms of ages of women, are there peri and postmenopausal women in the population that you're looking at?
Yes, they're included in the criteria, the study criteria, but it's broadly open to women over the ages of 18. Down the road, we want to focus just on specific populations, but we've included a big enough number of subjects to hopefully get some interesting data to drill into in specific subgroups too.
Okay, excellent. And then as far as the formulations of your products, you mentioned that it's come from what is research that's already been done. How did you go about, you know, deciding on that and deciding the formulations?
Yeah, so it was, you know, really a process of culling the best research we could find. Some of it is philosophical. I personally feel that although there's some great research around cranberry, the data really ranges. And with the amount of research that's been done, my opinion is that we would know by now if it was working well. So we deliberately stayed away from cranberry. One of our active ingredients is D-mannose, which Dr. Azen mentioned. And to be clear, D-mannose is found in cranberry, but it's found in blueberries and peaches. It just occurs in nature. So we really do think of ourselves as separate from cranberry. That's not the approach we're taking. But there are a handful of mechanisms that show really interesting outcomes in binding with bacteria. D-mannose in particular has some mechanism research that shows it's a competitive inhibitor for E. coli, which is the bacteria responsible for 90% of UTIs. So the product is, 2 of the 3 products have that ingredient in particular, so it's binding with E. coli, it isn't killing it. None of the products are taking any sort of antibiotic approach. There's no killing of bacteria, but it's just trying to help flush the urinary tract as well as possible to keep things in the clear. And we have 3 different proactive care products, one of which is a drink mix. It's called Target. And you drink it after specific activities like sex or exercise, whenever you may need to flush the urinary tract. The second product is called Control. It's a daily capsule, and it intends to cleanse the urinary tract of biofilm. And biofilm's a protective shield that bacteria can form and use to stay hidden. And so taken daily, Control cleanses biofilm that may build up. And our last product is Promote. It's a specialized probiotic that includes strains that are found in healthy vaginas. And research shows that vaginal health is linked to urinary health. And so that's the intention there. And most of our customers take all 3 products together to come at urinary health from 3 different angles.
The D-mannose is interesting. Am I correct in understanding that that is, and I'm going with my dietitian brain and looking at sugar. So is it a form of sugar with the ose ending there?
Yeah, it's a simple carbohydrate sugar.
Okay. And what, just, curiosity, especially when you were talking about the food, that's when I get excited about different things. What, if you can summarize the mechanism that D-mannose, the research has shown to help with prevention of urinary tract infections?
Yes. So the mechanism there is that D-mannose can bind with E. coli.
Okay, that's right. You said that.
So not kill it, but just occupy it to help flush it out of the urinary tract.
Okay, so once it's bound, then it's easier to get removed. Would that be a?
Yeah, that's the principle. Okay.
And then the other thing that I was curious, because you mentioned all those food things, again, dietitian brain working here, is there food, are there any connections in terms of food supporting urinary tract health specifically? Cranberries obviously sound mixed, but other things that you have found either in your research, Jenna, in developing these products, or Dr. Azen in terms of what food could be recommended if people want to have healthy urinary tract?
Why don't you go for it, Dr. Azen?
So when I talk about food for my patients, it's more specifically about for just triggers of lower urinary tract symptoms. We'll call it bladder irritants. Things like coffee will make you have to go more urgently, frequently. Some people, it's sort of different for everyone. Some people spicy food. I've heard people say tomatoes. Some people fake sweetener. Some people seltzer, but not so much for urinary tract infections. I counsel that more if we're trying to tease out the vague symptoms. That's one of the reasons I'm pretty excited about Uqora is they've put together, based on all this research, picking out individual things to put together. So I can let Jenna talk a little bit more about that, but the idea that we're trying to shift away from antibiotics and use things that are coming from food, coming from nature, things like that.
Yeah, definitely. I think I don't know of diet recommendations to control or fight UTIs either, just to directly answer the question. But yeah, the symptom, I think there are foods that can be irritant to sensitive bladders, which makes sense with what you're saying, Dr. Azen. But yeah, definitely there's a handful of theories that we've put together, and different research has shown different mechanisms, but there hasn't been the combination that we've put together in Uqora's products, which is another reason why it'll be really great to continue to build the research that shows that all those mechanisms in play together.
Excellent. Speaking of the coffee, we did get a question beforehand, or caffeine. We did get a question beforehand that came in. I'm going to just turn to read that from another screen. This individual says that asks, is the effect of caffeine worse than the effect of the acidity of coffee in terms of stimulating the bladder, is the first question. And then why does brewed decaf seem to affect my bladder just as much as regular coffee? And then finally, should I accept the fact that any kind of coffee is not good for the GU tract, or is this not exactly the case? multiple questions there. So Dr. Azen, if you want to address that, since you mentioned the caffeine as an irritant, and if you need me to repeat part of that, let me know.
Sure. I talk about this a lot with my patients, again, less for the urinary tract infection world, but more for just the urinary symptom world, specifically patients that come in with complaints of urgency, frequency, and in general, when you're coming to the doctor, doing a workup for the medical side of things, but once the medical side of things has been ruled out and we know that for the most part, lower urinary tract symptoms aren't going to cause things that are dangerous once that's been assessed. So now when we're talking about lower urinary tract symptoms, we're talking about degree of bother. And how we treat it is basically how much does it bother you? And that's where coffee comes into it as well. So it ultimately, basically for everyone, decaf, caffeine, there's something about coffee. It's not just the caffeine that causes that urgency, frequency, that irritation to the bladder. Now, what do you do with that, and how do you decide how that plays into your life? It depends how bothersome your urinary symptoms are and how much you like coffee. I have some patients who say, coffee is my life. I'm like, okay, so you're not cutting back. And other patients are like, it's just something I do. I'll try cutting back on it and I'll see how it goes. For the patients that say, coffee is my life, I'm not going to say toss that out, but sometimes I'll say play around with it. Maybe if there's a couple of days where you don't have a lot going on, see if you can scale back and see if you notice a big difference. Because maybe if you notice a big difference, then that will motivate you to try something else. Maybe you won't notice as big of a difference. And then other patients where it's like, okay, well, you know that you have this urgency frequency when you drink coffee and you like going for 2-hour walks a day, separate that. Drink your coffee one part of the day, go for your walk the other part. So it's all about kind of figuring out what the patient's goals are and adjusting to that. I am unaware of any research that says it's dangerous to the bladder. It's more just how much it bothers you.
Okay, thank you for clarifying. And Dr. Dunsmore, so do you see this with any of your patients, or is this an area that you address at all, or not as much?
In terms of coffee and bladder?
Yeah.
Well, I think we all as gynecologists have some minimal training in, bladder irritants and things like that. And it is always a good place to start. I approach it very much the same way as Dr. Azen. It's really about what does and doesn't work for your lifestyle and how much is this driving you crazy. It's the same thing with, I tell a lot of my women to, if they're up 3 times at night peeing, to stop drinking after 5 p.m. We've been so indoctrinated, we need like 32 ounces of water a day, and water is good, but there's a point at which you should stop drinking if you don't want to pee all night. And it's just, little lifestyle manipulations can sometimes control symptoms enough that you're not struggling with them quite as much, and that's all you really need.
And it definitely comes down to taking the individual into account, and there's not a one-size-fits-all approach, but trying to figure out what can work best for them is important. Excellent. Well, one thing it said there's 3 products that you have. Jenna, you mentioned that most women use all 3. Is there a way to determine which ones, if someone was looking at what you have available right now, if they only wanted to try one, how do they determine which ones to use?
Yeah, so again, they're all designed to be complementary. So if there's just one you want to try, my recommendation would be starting with Control. We kind of think of it as our baseline product. That's the one that I mentioned, is the daily capsule. It cleanses biofilm. But again, Target, the drink mix, is really helpful to flush the urinary tract after anything that might be more of a triggering event. The big one is sex. So I think for sure we recommend that for anyone who's sexually active to drink after. And then the probiotic, I think, is great if you're not already taking a vaginal probiotic, but you've heard from the range of panelists that there's varying opinions on that. And so I think for anyone who's considering our products, it's a good idea to talk with the doctor that you trust and get their opinion too. And I will say that, again, the products are built on great research. We've are approaching 5,000 5-star reviews. We've definitely been able to make a big impact, but everybody's different, and it's great to do your own diligence too.
And I will say, so my objection to probiotics is not this probiotic in particular per se. It's that most of the research in probiotics is done for gut health, and most of the probiotics sold are gut flora. So the lactobacillus in your product is also gut flora. And it's just hard because we haven't done the work to say, hey, those gut flora are then going to translate over to vaginal flora. And so, I tell my patients, it's probably not going to hurt you. It'll recolonize your gut. So that's great. And so I don't have any objection to them in that sense, but I don't really think we can say that they balance the vagina. There's a small amount of work being done right now on what exactly the vaginal flora really look like in different populations of women, because it actually varies, as well as, well, how can we put it back? And it seems like putting it back vaginally is going to be the way to go, but we don't really know yet. I mean, more research is needed, which is why I'm glad you guys are doing research in some of this.
Yeah, definitely. The microbiome research is super exciting. I was at the Eurobiome conference at UCSD this year, and it was wild to hear that up until 8 years ago, everyone was sure that urine is sterile. And, I think there's still some like varying of opinion on what that means and what a healthy urine microbiome would look like. But the acknowledgement that there is theoretically a healthy urine microbiome is like something that is like actively being researched now. And I think it's just really exciting to see the strides we're making, and definitely excited to be contributing to more research there.
Yeah, it's the same thing in the vaginal research, just understanding that different women have different vaginal microbiomes, perhaps at different points in their lives, and that they are, as we like to say, polymicrobial. There are a lot of bacteria that live in the vagina that are supposed to be there in certain proportions. It's when your proportions get abnormal that it gets difficult. And we don't understand it well enough.
Yeah, no, lots, sounds like lots of work to be done, and glad that people, thank you for Uqora doing some research in this area. We look forward to hearing those results. And certainly I think from all of this, here's information that women can take, and it is important to evaluate it within their own context and situation. So talking with a healthcare provider and thinking about what are your symptoms, what are most important to you, and figuring out how to make it work for your lifestyle is always important to always include the human in the treatment or prevention plan. All right. Well, I wanted to just give a reminder to our participants if they have any questions. So if you're on Facebook, just a reminder to thread those questions below the live posting. And then if you are on Zoom, any questions you can be sent through the chat or the Q&A function. We're going to start wrapping up here in the next few minutes. So just if you have any of those questions, go ahead and post them, and then we'll be able to answer those as well. So Dr. Azen, actually, Jen, I meant to ask you as well. You alluded to some more products coming down the line. Is that based off of the research that you're doing, or are those already in the works? And can you share anything about that?
They're already in the works, separate from the research we've been doing. I don't have too much to share right now, but if you go to our website in a few weeks, they will be there, uqora.com.
Excellent. So some foreshadowing, something to look forward to. Excellent. Well, Dr. Azen, do you have any final comments, recommendations, or if any of our listeners want to get in touch with you and happen to be in the San Diego area, how would they go about doing that?
Sure. So I'll start with sort of the final recommendations. We've gone through a lot of information, and I think one big recommendation is just if you have any concerns about your sexual function, your urinary tract symptoms, talk to your healthcare provider. So many of my patients are embarrassed, nervous, and they don't want to bring it up. The way that I'll hear about it, sometimes it's a male partner talking about his female partner who has these concerns, like, these are so treatable, like, have them come see me, or another doctor they like. And patients think their urinary symptoms, they're the only ones having them, they're the only ones going through this, and that is just not the case. This is what we urologists, gynecologists, doctors listen to all day, every day. So that would be one thing, is just talk to your doctor and feel comfortable talking to your doctor. If the first doctor you talk to isn't someone who specializes in this area, they can get you over to someone who can, because everyone has something they specialize in, but just keep looking, you'll find the right place. And then we sort of talked around all the different recommendations and research and things like that. But sort of with the approach of Uqora, Uqora's multiple products, the system, the website with the information. That's one thing my patients who have tried Uqora or started Uqora really come back saying they like is all the information that's on the website, the system, that they just follow these steps. By the time I'm seeing most of these recurrent urinary tract infection patients, they have a collection of everything that is sold in the pharmacy, and it's a nerve-wracking of mixing and matching because a lot of the supplements, you don't know exactly what's in them or what you're taking, so having kind of a set regimen that you're taking, and then also having access to Uqora's explanation of what's in things and how the things work, just learning more about it. It's kind of a community that has this information, is another thing that I think is unique and special and can be really good for patients who have something that, again, might be they might think it's a little embarrassing to talk about or think is unique to them, but it's such a big problem and so many other people are going through similar things. And if someone's in the San Diego area or interested in more, I'm part of a private practice. It's if you look up my name, Carrie Azen, on Google, it should direct you there. The name of it is On Call Urology Associates, although I'm sure there's lots of ways to get to it. And it's, if you want to call the office to look into making an appointment, it's 619-828-1000. And like I said, there's lots of healthcare providers who specialize in this. So if you start with someone who's not the right fit, don't despair.
Well, thank you for that information. I really like how you highlighted too, these are things we need to be talking about. Again, comes back to women's health. We all need to voice louder for that. And so we have that role. And so thank you for your work in doing that. And if you take away nothing, and listeners from this, is that, again, you don't need to suffer in silence. You can reach out. There are healthcare providers. There's research being done. There's products that are out there specifically to support you.
And I just want to add, we as gynecologists say the same thing. Please come and tell us about it and talk to us about it. We can't read your mind. We need to know if you're having painful sex or you're having urinary issues, and then we can help you. And if we can't help you, we know which urologists are great with female issues, and we know which urogynecologists are in our region. So we can find you a provider who we can move you on to, who can really help you. We're a great resource.
Excellent. And Jenna, if any final comments on your behalf, and how can women find Uqora if they're interested in learning more?
Yeah, I think just echoing Dr. Asen's sentiment that you are not alone. I think that feeling of doing everything right and still feeling frustrated is so common, and finding a collective voice around it is so important. And yeah, you can find us at uqora.com. That's UQORA.com.
Excellent. And Dr. Dunsmore-Sue, any additional comments for you, and any information, can you provide some information just on the telehealth platform, similar to what you did at the beginning?
Happy to. So in terms of my portion of Genève and the telehealth platform, much like Uqora, we sort of provide this holistic thing where there's a lot of great information as well as access to the things you need to manage your health. And in terms of the telehealth platform, it's one-on-one, face-to-face, Zoom type video consultations with gynecologists who have special training in menopause. So we really can talk to you about hormones and how hormones change over time, the whole menopausal transition, perimenopause, menopause, postmenopause, all those different stages of transition, and talk to you realistically about the risks and benefits of various treatment types. So whether it be hormones or other alternative treatments, or even herbals and supplements, and how they can play into maintaining a healthy life into and through menopause.
Excellent. Well, thank you all very much for your time. I didn't see any additional questions come through, so either our audience is formulating things or everything was very well explained, and they may have some additional questions that they might reach out to either directly through your website or through Genève. So thank you very much for your time, and I will just mention too our Health Fix program. The subscription there is a monthly subscription where you do have access access to a health coach, and you through calls as well as through texting. And this is an opportunity to be able to work on a variety of different lifestyle strategies, and certainly could be something if you are working with a urologist or a gynecologist, if they've given you recommendations around implementing things with your lifestyle, having that coach there can also provide that support and accountability around doing that. So the example around the water, I do work with a lot of clients on drinking water for the benefit, a lot of health benefits, and it's different for everybody, and having that support, accountability, and ways to implement those strategies to make it a habit can be helpful, just to have that coach support. So that's available to you as well through Gennev, so take a look at that information. And again, thank you so much, Jenna and Dr. Azen, for your time today and giving us more information about Uqora.
Thank you
for having us.